faculty, Dr. Sharath Ashokan, our VPs, CDH Chairman Sushant, President-elect, I don't know who all are there in this group. So, our technical assistant, CD Chairman of Malabar, Dr. Unni, warm good afternoon to all. As we all know, the COVID-19 grips the world. The whole dentists are really struggling. We are all in an anxiety and fear now. So now we are all acquiring knowledge through webinars and utilizing our time. Idea Kerala State also is doing the same thing in the present scenario. In this present scenario of COVID pandemic episodes, we all should be aware, and we are doing many webinars in infection control and post-COVID treatment protocols and all. So the dental treatments in the next coming to be little difficult. So, and behavioral changes in our practice. So actually we are hibernating now with the webinars and all. മലയാളത്തിലെ പ്രമുഖമായ ഒരു സിനിമയുണ്ട് പുലിമുരുകൻ. അതിലൊരു ഡയലോഗ് ഉണ്ട്, പുലി പതുങ്ങുന്നത് ഒളിക്കാനല്ല കുതിക്കാനാണ്. So we are struggling to achieve something more. Let us have a good webinar with soft skills. Today's faculty, Dr. Sharath Ashokan, is well-known personality, and he will do justice to all. That is surely I know. So, with immense pleasure, I would like to inaugurate this program, and I would like to congratulate Dr. Sharath and team and the technical team of IDA Malabar and our CD chairman Faizal for all the help. So thank you. Over to Faizal ji.
Good evening to all of you. Over to Dr. Deepu for the felicitation.
Good afternoon, doctors, ladies and gentlemen. Thank you all for being here for this webinar hosted by IDA Kerala State. In these difficult times, when everyone's sitting at home, it's a good opportunity for us to refresh our skills. And I'm sure that Dr. Ashokan Sharath is going to give us the skills that are necessary so that when we all go back to our practices, there will be a lot of people whom we need to address a lot of issues because of these peculiar circumstances. And I'm sure that this program here will help us and arm us with all the necessary information and the techniques, keep our patients and all of them happy. Once again, thanking you all for being here on this day and wishing everyone a happy learning. Thank you.
Over to Faizal for the introduction of the faculty.
President Dr. PC, Secretary Dr. Deepu, faculty Dr. Sharath, dear esteemed members of IDA Kerala State, a warm good evening to all of you. I welcome all of you for the first webinar of IDA Kerala State. The topic for the day is What's Up, Doc? Soft skills in clinical practice. And we have a very well-known faculty to present this lecture. Dr. Sharath, he has graduated from Annamalai University and he did his MDS from the Meenakshi Ammal Dental College. After finishing MDS, he did his PhD from Meenakshi Ammal University, Chennai. He is the recipient of Young Dentist Award from the Governor of Tamil Nadu in 2012. He was also recipient of Young Dentist Research Award by Indian Society of Pediatrics and Preventive Dentistry in the year 2008. And he also got the Health Excellence Award in 2009 from IBAM. He has about 70 publications in reputed journals and is the assistant editor of a PubMed Index journal, that is Indian Society of Periodontics and Preventive Dentistry. At present, he is working as the professor and head of Department of Pediatric Dentistry, KSR Dental College, Tiruchenkote, Tamil Nadu, and is also a director of Academy of Dental Excellence, which is a NEET coaching center at Tamil Nadu. I welcome Dr. Sharath for this lecture. Over to Dr. Sharath.
A very good evening to all the members of IDA Kerala State. Thank you for this wonderful opportunity during this COVID lockdown. So I thought I should keep you guys as the first slide in the introduction of my lecture. I didn't know much about webinars 10 days ago, and I'm sure most of you didn't know. And now all of us locked down at home, we're learning a lot of skills. And one such thing which I think we should really think about is the soft skills, and that is going to be the topic for discussion today. But when I said, when Dr. Faizal called me and said that we would like to have you give a lecture for the IDA Kerala State, the first thing we generally think about Kerala, generally Kerala is God's own country. And I come to Sabarimala for the last 23 years, and my God still lives there in Kerala. So it is definitely God's own country for me. All the districts in Kerala, apart from Tamil Nadu, I think the only state where I think I've gone to all the districts is only Kerala. It's probably for a lecture, for an exam. Kannur is obviously one of the close ones to my heart. And obviously, this place, I was born in Kollam, Kadapakada. So my mother always keeps talking about Kerala, and a lot of things we discuss about Kerala, and my hometown would still be Kadapakada there at Kollam. So thank you, Kerala State IDA, for giving me an opportunity to start this webinar series, and it's an honor for me to be amongst you here this evening. Again, the first stalwarts thinking about Kerala, the first few people I would have known in my life would have been Mammootty and Mohanlal at some point of time in my life. I'm a periodontist, so I'm going to tell you a lot of stories here today. So don't expect me to give you a lot of technical points and stuff like that, but it's going to be useful for your practice, that I can assure you. So as a periodontist, I'm going to give you lots and lots of stories. And I start with this particular thing. So this is about the first people whom I used to think was Mohanlal and Mammootty, now has moved to Nibin Pali and Dulquer Salman and Fahad Fasil. But what makes everybody look at Kerala are not these superstars right now, but it's Kerala, the leader in COVID management. It's not a political statement, but I'm sure everybody across the country, okay, and across the globe are looking at Kerala for the wonderful work it has done towards this COVID lockdown, how you're managing this particular situation. So kudos to the Chief Minister and the Health Minister, Sailaja, and her team for doing a wonderful job. I would like to stress one point here. I would like to talk about something called control and loss of control at this point of time. I would like you guys to remember there's something called control and loss of control, which will come about in my lecture. And I think Kerala State has full control at this situation right now. And United States of America is supposed to be boasting to be the biggest powerful nation, is out of control or at loss of control at this point of time. But let us forget about Trump at this point of time, because we are talking about Kerala. And one person who is very dear to me, Kerala State, Faizal sir. Thank you so much for inviting me to this presentation and giving me an opportunity. Every year I come to Kannur, either for a guest lecture or for some exam or something. He was my first teacher in periodontics when I did my UG in Annama University. Thank you, sir. You've been such an inspiration, and you've always given me an opportunity every time you got the opportunity to give me one. Thank you, sir. So these are the VIPs for me from Kerala as of now. And as I told you, I'm going to start with some stories. So I told you I'm a periodontist. So this is a little poem from English 8th standard syllabus. written by an American columnist or a poet who's in a comedy poet, I should say. He's a columnist who writes in newspapers. The title of this presentation aptly suits our situation right now in lockdown. This is going to hurt us just a little bit. Yes, it is hurting us all a little bit. Whether it's career or whether it's money making, we are all locked down. It's hurting us a little bit. But he didn't title this for us for the COVID lockdown situation. Actually, he titled this about dentistry. The poem is about dentistry, and he taught children. Some tortures are physical, some are mental, but the one that is both is dental. And mind you, it was in the English CBSE poem syllabus in our 8th standard children in India as well. So as periodontists, we are used to treating these kind of children who learn something about dentistry. So I am going to come and give you some tips here in for your private practice. So let us look at this, whether it's dentistry, whether it's any medical profession, people who walk in like this always want to come out of their hospital or the dental clinic completely happy, completely cured, completely healthy. So what is the key to holistic health? People are looking at holistic health. They only want to go in like a weak person. When they come outside, they want to be totally happy. And for that, we need to think about something called people skills. People skills are also called interpersonal skills or soft skills. Most of our CDE talks or our conferences and conventions give stress or focus on technical skills. There are not many forums. We don't have it in our syllabus to talk about people skills. So we don't deal much about people skills in our particular curriculum as of now. The Dental Council doesn't teach us about people skills, the soft skills. But mind you, look at the second picture at the bottom. The soft skills and people skills are more important than your hard skills. Doing our RCT, doing a filling would only come into the technical skills or the hard skills. The soft skills or the people skills is very, very important when you do customer service business. And mind you, dentistry is our business. We do a business called dentistry, and we have to create a win-win situation for this. We have to keep our patients happy. We must keep our pockets full. And at the same time, everybody should be in a happy situation. So the topic for today is WhatsApp Talk. This is my favorite cartoon character, Bugs Bunny. So I always keep this as one of my slides. So I decided to keep this title as WhatsApp Talk. And the title for my presentation is going to be predominantly on the soft skills in clinical practice. Okay, look at this. I Google searched something on dentist for you, and I found this wonderful, interesting picture. Okay, all my friends think that I'm minting money, right? I'm taking bath in money and just enjoying. My mom, my parents think that I'm a doctor taking care of all the patients, doing justice. Okay, there are some guys outside think, oh, you are a dentist. Sometimes we write doctor in our flight tickets, train tickets, and sometimes we say, oh, you're not real doctor, you're just a dentist. That's sometimes what the society thinks at us. And my patients think that I'm picking the money out of their pocket. So I'm just lifting money. Every time I look at a patient, they're thinking that I'm stealing some money out of them. I think I'm doing an executive job of business. Sometimes I do those lousy composite restorations and I feel like that. But right now, I don't even feel like doing a composite restoration. In this COVID situation, I really feel like this. I'm just like, I don't know, have to do anything. All the clinics are locked down. What I'm really doing right now is sitting like that with all the dental clinics and dental colleges closed at this point of time. So look at the brain of a dentist. I'm going to pull some names here and there. Some of my friends in periodontics from Kerala, I think. This brain, I would talk about Dr. Korath Abraham from Cochin. I think if Dr. Korath is here, some of the friends of Korath should know that he's always behind his lab. He does his laboratory work as well. So I think his brain is probably going to be, the predominant portion of his brain is going to be interaction with the dental lab all the time. Maybe about conferences, maybe about buying material, maybe about paying the debts. So this COVID lockdown, we don't have practice, we have some debts to pay. And we have very, very little leisure time. We have very little time for family, right? And this is how our brain usually works. Or sometimes, you know that you see a patient, the patient has a very clean mouth when he walked into the dental practice, but actually he has a lot of cavities. You know that this patient has brushed just 1 hour or just before they came into the dental office, but they did not brush for 365 days, right? So instead of brushing on all other days, they make sure that they brush on the day of the dental visit, and they come to your dental office. So you think, your brain thinks, okay, this patient is just made sure that they brushed before they walked inside. And this is sometimes common in a pedo practice, right? We don't want a pedo patient coming in up on a general practice, because we know that general practitioners really want to stick on time. Time is money. And when you are looking at practice, you can't afford to have a pedo patient coming and crying and spoiling away 1 hour of your time. So, or sometimes you don't want a nagging patient. You tell your receptionist, please give appointment to that particular patient. You fix the crown when I have gone to the conference or convention. You tell the assistant doctor, I don't want this patient when I am here. So you better give this appointment at this point of time. So most of our time, our brain works like this. We talk about lab, conferences, materials. We think about why the patient has brushed. We think about why not to give appointment to this particular patient. And this is how, unfortunately, how our brain works. But now let us look at from the patient's perspective. This is an amazing survey which was done, and they found the top 10 reasons why people hate dentists. Why do general population hate dentists? What are the reasons why they hate dentists? Obviously, the first reason is going to be needle, then it's going to be pain, then it's going to be anxiety, drill, the invasiveness. So I'm going to talk something about invasiveness here, the sounds, the smell, the cost, the lectures. What are lectures? Some people might be thinking, I don't work in a college. I'm not a lecturer. I don't give lectures in my practice. But yes, we do. I'm going to talk about that too. The poor service which some dentists provide, and the bad memory. Some of us might have had bad memories in dentistry in our young age, and we didn't want to go to the dentist because of such bad memories. So these are the 10 top reasons why people hate us. And I think we have to work on making sure that we can reduce these 10 points so that they feel a little comfortable with us. Coming to lectures, look at this. I had a wonderful article. 2 studies were done in the world in 15 years difference. First study was done in around 84, and the second study was done in 1999. And both the studies, mind you, told that all doctors, 73%, okay, 73% of doctors stopped the opening statement of the patient in 23 seconds. That means you only give 23 seconds for the patient to tell his chief complaint. Okay, the mean time given for a patient to tell about his chief complaint is only 23 seconds, right? So patient, as soon as the patient starts talking, we put a mouth mirror inside and we start examination. And the patient feels like this: I would love to answer your questions, doctor. Unfortunately, your hand is inside my mouth, so I'm not able to answer your question. So we don't wait for more than 23 seconds. Most of us at least don't wait. And there is a beautiful another slide. Dentist is a person who numbs the mouth, stuffs with cotton, and starts the conversation, right? We just dump something inside. We ask them, how was your holiday? Next time, as soon as patients start coming into a practice, so we would put the mouth mirror inside, we would place the drill inside somebody's mouth, and we would ask, what did you do in COVID lockdown? Okay. And the patient is going to say, wah, 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 right? And this is something which we should really avoid, because when you ask a question, make sure that you give them some time to answer that question, have some patience, and that is something very important in your practice. Okay. This is one of my favorite interesting topics which I generally talk about. Study of distances is called Proxemics. Okay. So when you are at a 2 feet distance from somebody, maybe your wife, your spouse, your children, you are at an intimate distance. When you stand at 2 to 4 feet distance, it's called the personal distance. 4 to 12 feet is called social distance. And while I'm sitting miles and miles away from you, I'm sitting at a public distance from you. When you go to a mobile shop, or when you go to a grocery store, you're going to buy a milk packet, how far do you stay from the shopkeeper? You don't go at an intimate distance. You don't stand face to face like that. And you don't ask him, I need a milk packet, right? Dentistry invades into personal space. Okay, I come from a small town called Virudhunagar in Tamil Nadu. And when the endodontist started his first practice here, there was one lady who went to him. And this guy was taught about ergonomics in his dentistry school. So he had to recline the dental chair behind. And he had informed the lady that I'm going to recline your dental chair. But this lady found it a little inconvenient. She was finding it that she had to literally lie down on that doctor's lap. Okay, so she came around telling people wherever she goes for this music sangam and all these things, the Tamil sangam kind of thing which we have here. She was telling, I went to the dentist guy and I had to literally lie down on his lap. Okay, so this is the inconvenience which we cause to people because we intervene into the personal space or the intimate space. The intimate space is like your spouse's space. Okay, and mind you, every time you put your hand into somebody's mouth, we always stay very, very close. And that is something which patients find very alarming sometimes, and you have to be very careful about that. Okay, fear of pain. Okay, so fear and pain are something which always keeps a person away from dentist. There are two words which I want you to understand. Okay, it's more for pedo people, but it's always present in general practice as well. Sometimes you find a 40-year-old man or a 40-year-old woman. She wouldn't want to come and sit on the dental chair. She would say, "Can I hold this assistant's hand? Can you do it very slowly, doctor? I'm very scared of this particular thing." Okay, so there are two words. There is a word called BMP, which is not biomechanical preparation. BMP means behavior management problems. So people who show, move their hands, legs, show facial expressions, these are people who have behavior management problems. Children who come and roll on the floor, children who come and throw temper tantrums in a practice have behavior management problems. Sometimes you find a 10-year-old child who has a central incisor, but the 5-1 is just hanging around there. Okay, you don't even need an LA. You just have to do that. Okay, just do that and it will go. But this guy would roll on the floor and try to not get onto the dental chair, and this is called a behavior management problem. Okay, so all people showing behavior management problems, okay, need not necessarily have dental fear and anxiety. Okay, but all people with dental fear and anxiety, if I'm scared about dentistry, if I have a phobia towards needles, then I might express behavior management problems. That means dental fear and anxiety might express more of behavior dental management problems, but people who express behavior management problems need not necessarily have dental fear and anxiety. Okay, let us look at what are the reasons for dental fear. Okay, fear of unknown. If I were to take you into a very dark room somewhere totally isolated, we know that quarantine was supposed to be a very harsh word before this COVID lockdown. If somebody said I would come and quarantine you, okay, we would have thought, what would they do in quarantine? It would have been something unknown thing for us. Anything unknown is something very scary. So anybody who walks into a dental office does not know what a root canal treatment is. They have pain. They think that you will come and save them, but they are still scared. How are you going to relieve them of pain? So fear of unknown is a major reason for the dental fear. The second thing is fear of pain. As a dental practitioner, you might say, I use single tooth anesthesia. I use wand. I use lasers in my practice. Whether you use laser, single tooth anesthesia, wand, cartridge, okay, any local anesthetic system, still there is some amount of pain associated with dentistry. And if you call yourself a painless dentist, you're going to be a liar. So don't tell anybody that it's going to be painless. You can reduce pain to some amount of extent. But the point is, pain is a very subjective phenomenon. So not everybody can withstand the pain in the same way. The threshold for one person is entirely different from the threshold of another person. The fear of pain is the second reason for dental fear. Okay, lack of trust. The picture which you see at the bottom is called a trust game. You're supposed to stand on a plank, which is about 3 to 4 feet. And people, your friends or your family is supposed to stand behind like that, holding the hands stretched out. And without looking back, you're supposed to fall automatically behind, right? Without any support, you're just supposed to fall down. Only if you have a sense of trust with all the people below, you will be able to fall down like that. It's called the trust game. And when people walk into your dental office, they don't trust you. Somebody told them that this dentist took care of me well, okay? Or they have come to you before for once, and then you did something, it worked well for them, then they come there. Sometimes many of us, many of the pursued patients still consider us as the family doctor. So they wait for us. That's building up the sense of trust. So once a patient has trust in you, then the patient would come to you. Once you become their family dentist, then it's done. The trust is developed. So sense of trust is something important. The next two, I was talking about a sense of control in Kerala state And what Trump couldn't do in USA, loss of control. Loss of control is something very, very common in politicians, common in people with high power and authority, right? Policemen, administrative officers, IAS officers, ministers, chief ministers, all these guys always have a sense of control. They think that they have power to do anything. Unfortunately, dentistry is one place where they have to come and keep their mouth open, but they can't talk. We are the masters at that point of time. So they feel that they don't have the control and power over the situation. And this is called a loss of control. Mind you, it is not only in children. Children, when they come to the dental office, they are very pampered at home. They know how to get things done. So if you ask mommy, mommy says no, you go and ask daddy. If daddy says no, then you go and ask your uncle or aunt or a grandparents, and you'll get things done. This child who walks into the dental office suddenly thinks, okay, you are a dental practitioner and you know that you can remove that root stem RS, and the mother tries to help you. The child is shocked. The child looks at the mother and says, you came with me. You are supposed to be on my side. Why are you joining with this dentist, the stranger, and trying to pull out my tooth? And this is a loss of control situation. And mind you, it is not only in children. Lot of adults have this loss of control because they're very, very powerful guys. And these powerful guys can't wait. So you have to give them prompt appointments. When they come in, they want to do a lot of things quickly. And they want a sense of control. Unfortunately, dentistry does not give a control to them. We are the masters who have the control. Okay. So loss of control is something which you have to look in your practice. This is my favorite. I'm sure all of you, irrespective of age, right from 22, 23 years to 50 years, anybody who is practicing dentistry, I'm sure when you are in your dental school, some of your engineering friends would come and ask you, how do you put your hand into somebody's mouth? Okay, how do you deal with saliva? And how do you guys deal with this thing? And we just say, we just give one injection. And most of the time, we wouldn't even remember the composition of LA in our college. And that's the only injection we give most of the time till date, right? And mind you, an injection into the eye, an injection into the ear, injection into the nose, and the injection into oral cavity feels exactly the same. Okay. So many patients who walk in, okay, when they're first time walking in, especially with their children or people, they think when they were not educated, okay, they think an injection is given in the hand. Okay. And sometimes we have to say it's just near the tooth, and they're shocked because it is a personal body cavity. Eye, ear, nose, and the oral cavity or body cavities, a prick into the eye, a prick into the ear, and the oral cavity means the same. So this is called as fear of intrusion. I would like to quickly remind you that we spoke about invasiveness. That is also intrusion into personal space. When we stand too close to that person, when we stand at an intimate distance and you prick into somebody's mouth, you have to be very, very careful. They have all the rights to be scared of you. They have the right to fear. They have the right to have pain fear. They have the right to have fear of unknown. They have the right to have fear of loss of control. And they have the fear of intrusion. So dentistry, yes, it's a very painful thing. The other thing which is very, very common is people browse on the net most of the time. Okay. Internet is a double-edged sword. I started saying that I didn't know much about webinars. I didn't know what Instagram was. I didn't know what Twitter was. I didn't know Zoom and GoToWebinars, but I'm organizing a series of webinars from my ADE Academy as well. So I'm on Zoom with you guys today. I'm sure most of you have learned Zoom and webinars at this point of time. Yes, internet is a double-edged sword. It is helpful sometimes. It is not helpful sometimes. It is up to how you use it. Okay. So you feel so angry, so upset. I should say, taking all the rights with Kerala State IDEA, we feel so egoistic sometimes when the patient walks in and says, I think I need a root canal treatment. I think I need a filling. Okay. So we always think, why is this guy deciding the treatment plan? Who is he? I did dentistry for 5 years. I did post-graduation for 3 years. Why is this guy coming and dictating terms? Because he read it on the internet. He read irreversible pulpitis. Mind you, we are the ones who write about our information in the internet, right? We talk about pulpitis, we talk about root canal, and that is why they're going to browse on those particular things, right? We have our own websites for our clinic. If you're going to buy a mobile phone, okay, we would just see Snapdeal first, then go to Flipkart, then look for Amazon, then look at which one gives the best offer, Sometimes we would go to a store and just take the phone, lift it in our hands and see how it feels. Leave it there, come back to the online and buy it on Flipkart, which gave you the best deal. So mind you, internet, yes, people have the right to browse in internet. Don't say they can't browse on the internet. They always come in for the second opinion. They could go to multiple dentists like this and walk into your clinic. Don't feel angry about it. It's their right. Okay. Imagine that you bought a new car. Okay, I have a friend of mine who said, Modi got this car for me. I was shocked. I asked him, sir, this is an Audi. Don't tell me Modi got this for you. He said, yes, Modi got this for me in November. And I said, sir, November. It was exactly the time when he did all this money changing stuff. So the 1,000 rupee notes and 500 rupee notes were not working. The demonetization came in and he didn't know what to do. So he bought a second-hand Audi car. It's a true story, right? So most of the time, people buy a stuff, right? And likewise, people think that you bought a new car. The patient thinks, doctor bought this car in my money. We do a renovation. People think, the patients think, yeah, doctor bought this in his money. It is true. Dentistry is our business. We make money with patients. It is not wrong. It is right for them to think that they bought the new clinic, you bought the new dental chair. Yes, we do business, we buy it, and it's not wrong. So it's a right for them to think that you bought it with their money. Yes, we are buying into their money, and it's still okay. I'm going to show you this lovely article. It is from February 1997. So this article is 23 years old. This is an award-winning journalist, William Asenbaga. He had a dental problem just before he had to travel to another state in the US, and he could not get an appointment with his regular dentist, his own family dentist. He could not meet that guy. So he had to go and get an opinion from another dentist. He wasn't convinced with what this dentist said, but he had to move quickly because he had some work for journalism. So he tried with another dentist, and that dentist gave entirely a different opinion. So then he went on to another dentist, and these were 4 important, interesting things which I found in that article. Your dental work is lousy. One guy said that your dental work is not even good. The other guy said your dentist knows his stuff. He knows everything what he knows. Then this guy got confused. So he went to a few more people. Then he said, one guy said, there are 2 options. This guy really got confused. If it's fever, there's one option for treatment. If it's any other body pain, there's one option of treatment. There may be different drugs. But why are there 2 options of treatment? So he thought that these guys are just fooling around with something. So he decided to do a survey in the entire United States of America. So he went to all the 50 states in the United States of America, and he got an entire list like this. So for 1 tooth of dental pain, he had an opinion of 11 crowns by one dentist. One guy said 21 crowns.
Really? No problem.
Hello, sir.
Continue.
No problem. Thank you. Thank you for the support. Thank you.
Okay. Then there were a couple of guys who said 28 crowns. You can see Memphis and Salt Lake City. He had only 32 teeth, and almost except the third molars, all the 28 teeth had to be replaced with crowns. And the budget, maximum budget which was given was, mind you, $30,000 US in 1997. It is published in Reader's Digest as How Dentist Rips Us Off. And finally, you know what he did? He came back to his own dentist, the family dentist. He paid $50, took an X-ray, and did a very small elective small procedure, and his pain was relieved. So what happens is, this is what happens. Sometimes I've heard some of my friends in North Kerala and South Kerala say, in North Kerala it's different, South Kerala is different. Yes, it is true. Chennai is different, Bangalore is different, Mumbai is different, Tamil Nadu is different, Virudhunagar is different, right? But it depends on what you want to set your fees as. So I would suggest that people can browse, people can make diagnosis, they can take multiple opinions. Don't feel angry about it. Focus on your quality. Most of IDA works towards common guidelines these days. They give you a list of what to charge patients. So that's good that we have some common guidelines depending on the place. But our principal focus should be on quality. We should not be bothered about what the patient is thinking. Imagine, from a psychologist's point of view, we always think about the other person, what is going on in his head. And that is exactly why we feel offended. That is why we feel egoistic about us. We should stop looking at that person's perspective. We should accept that there is another perspective to it. Okay. So I would suggest the next most important thing we should learn is empathy. There are two important words in psychology here. One is empathy. The other one is sympathy. And there is another word called pity. Pity and sympathy don't mean the same. Okay. Pity is saying power. Okay. That person is power. That is pity. Sympathy means you are sharing that person's pain. That means the pain is divided into two halves and you are sharing that person's pain. Sympathy and pity don't work in dentistry. We need something called empathy, putting yourself in another person's perspective and think, if you are going to buy a mobile, if you are going to buy a shoes, would you browse? Would you ask people? If you are going to buy a shuttle racket, would you ask for different opinions? Yeah. So that is what patients are doing. And that is how we should establish our communication. Okay. We are all practitioners, okay, or we are working in a dental college. I think this is something very, very important that we must understand, because empathy not only to your patients, but empathy to your team. That is very, very important, because a lot of people log in from morning to evening with you. Are you going to be a leader or a boss? I would suggest that all of you be team leaders, because the leader in the first picture on top, he leads from front. They work towards a common goal and they share the success of the goal. But when you're a boss, it's like these IT company guys complaining, sitting that the boss sits over my head, expects me to do work, pushes me from behind, we pull the load, and the credit always goes to something above, right? Whether you are in a dental college or in your private practice, I think you need to acknowledge and empathize with all your faculty, your receptionists, your technical staff, your assistant doctors, your assistants, nurses, everybody. And that's very important to be a good leader. So what is the basic difference between a boss and a leader? The boss gives orders. The leader gives direction. The leader gives advice and not answers. The leader admits mistakes. He listens first. He gives credit to you, and he's like a coach. Okay. The bosses always take it first. They take the credit, right? That's how it happens. Okay. So I think we should all learn to be leaders here and not bosses in our own private practice or in the dental college with we work. And coming to that, empathy and being a team leader. Empathy, being a team leader, always follow something called as gratitude. And gratitude is something we should be very thankful. Whether it's a patient who pays the money, whether it's the technician who helps us, whether it's the sweeper who sweeps with us. Okay. I'm sure most of us, I wash utensils now. I'm cleaning toilets. I removed the filter of the AC, right? I'm wiping all the dust in my home, right? I wouldn't have done that before. I'm sure all of you, this lockdown has taught us one word, and that is gratitude. And when we get back to our practice, I think we should remember one word, one take-home message is gratitude. Gratitude towards your patients, empathizing with your patients, gratitude towards your practitioners, your fellow people, whether in college or something. But when you have gratitude, I think there are four important things. Focus on people, not performance. Be very specific in your gratitude. Don't say good job. Say good job for coming early and making sure things are happening. Be complete in your sentence. So the last part of my presentation, the main part of my presentation, which would last only about 15 to 20 minutes,
I think there's a slight network issues at the faculty side. He will try to reconnect in a few minutes.
right? So, sir, thank you for this opportunity. Rather, I would say Kerala State, thank you for this opportunity.
So we lost the last few minutes of your presentation. There were some network issues we couldn't hear.
Did we log out?
Yeah, no, Sharath, the slide from the beginning, can you talk? The gratitude slide.
Okay. Okay, I was talking about boss and leaders, And I think there we got a little disconnection because of some internet issues. And I told you about boss and leader. I think the most important thing we need to understand here is empathy in your practice, and you need to be good leaders. So when we talk about empathy and being a good leader, it always ends up with gratitude. I was telling you, gratitude is one most important thing which we have learned in this lockdown. I was telling you that I'm cleaning toilets, I'm removing AC filters, I'm wiping fans of the dust, right? With dust, I'm washing utensils. And these things I wouldn't have even bothered to do. These are simple gratitude, simple things which you can do for your family at this point of time. I know we have time and then we are doing this. But when you go back to practice, please remember the sweepers, the technicians, the assistants, everybody out there in your dental practice, as well as in your college, have a sense of gratitude. And how to practice this gratitude? Is it okay, Faizal sir? Are we fine?
Yeah, continue,
okay.
continue.
And when I said about gratitude, the most important thing about gratitude is focus on people. Think about people most of the time. Okay.
Yeah.
We have to focus on people, not on performance. And we should be specific in our gratitude. Don't just tell, thank you. It was a good job. It was awesome. Don't say that. It is a very blunt statement to say. Be specific. Be specific. Tell them that I appreciate that you could come early so that we could finish this job together, right? Complete the statement. Make them feel that you acknowledge the entire effort taken by them. Customize your Thanksgiving, right? Don't buy 10 cards of thank you the same way and send it to everybody on their birthday and say thank you for being a part of this team, right? Customize something. Just even write it on a small pin-up board and tell some of your faculty that you did a good job because of this particular thing. It makes them feel more happy. Making another person feel more happy is the best way of empathizing with them. And don't fake it, because most of the time, communication, which I'm going to talk in the next few slides, that's going to be the major part of my presentation, which will last only about 15 to 20 minutes. But don't fake your gratitude, because people can actually understand that you're faking that gratitude. Okay, so we are going to the last part of my presentation. Okay, that is communication. This answers most of the questions which I have raised during my presentation. The first thing I want you to remember is conversation or any communication is predominantly non-verbal. Okay, mind you, if I had just sit in one place, though I'm sitting in a webinar, I'm staying away from you. If I didn't raise my voice here and there, if I didn't give my stress, okay, if I didn't move my hands and gestures, if I didn't try to establish an eye contact through this webcam, the information which I give is not going to get passed on. Communication has one sender, one receiver, and there is a medium like this internet, and the language which I use, the English, is actually sending the message. Okay, so conversation is only 35%, or communication is only 35% is verbal. When I say verbal, it is what you say, how you say, and when you say. It's very, very important. Okay, I had when I started my practice about 15 years ago in Virudhunagar, I still remember pedo practice, exclusive pedo practice in a small town. Always found something very interesting. So I just told this guy, get up and spit. Okay, so he got up and he turned to his right and spit there. So I had to quickly move my legs away because my spittoon was on the left. The communication which I gave is get up and spit, right? And I found this particular thing very interesting yesterday because I was trying for more stories, and I found this. When I said rinse and spit, I meant in the sink. How does the patient know, right? So the patient didn't know. The person who has not walked into the dental office does not know this. I'm sure some of you have read a joke on prescription by a doctor. The doctor says, take this as medicine, right? So, and the person eats that paper as a prescription and comes back after 3 days and says, doctor, I'm still not relieved of my symptoms, right? Communication has to be clear. It is how you say, what you say, and when you tell them. Okay, that's the right time to convey certain things. But communication predominantly is non-verbal. The facial expressions, the tone, the movement, the eye appearance, the eye contact, the posture plays a big role in non-verbal communication. So look at this particular thing which I have circled, the closeness, invading into someone's space. I told you about invasiveness, proxemics, when we sit into an intimate distance, and look at that posture, the slouching posture. Okay, so imagine I give you a posture like this. Imagine that you guys are talking from there, and I give that posture like this. Okay, at backward slant. Okay, the upward backward slant with crossed hands. Okay, just like that. It's like saying, okay, you tell me whatever you want to tell. Okay, I will see. I will just listen to it. I will take it whatever I want to take. Right. So an open posture, a forward lean, is something which shows you that you are interested in listening. Okay. So these are non-verbal communication. A patient knows you are asking a patient a question, and then you are getting things ready because you know that you only have 20 minutes with this patient. You have very little time with this patient. So you asked a question, but you're not listening to the answer. You are doing something else, right? If you are a periodontist, I am sure you will be in soup, because a child will ask you, doctor, tell me what I told you, and then you will be in trouble. But fortunately, general practice, okay, most of our patients don't ask us. They try to repeat the same thing again and again, right? So the ways of talking, look at this, the ways of talking, the pauses where we use, the laugh, sometimes we have to give a chat with them. We have to talk about something. We can't think about 23 seconds of opening statement, right? I told you we only have 23 seconds to listen to the opening chief complaint. If we have that, I'm sure none of the non-verbal communication could be picked up. The most important thing you should learn sitting at home will be the transactional analysis, which I'm going to show in the next slide, and picking up non-verbal cues. If your wife did that to you, okay, that's a non-verbal communication. If they did that to you, it's non-verbal communication, right? So they don't have, your spouse does not have to give you a word of answer. Looking at their facial expression, you're able to understand what mood they are in, right? So that's the best thing I want you to learn, non-verbal cues given by the patient. That is very, very important, and you have to learn that. Okay, so there is something called hearing and listening, which I want you to differentiate. You asked a question to this patient. Okay, I asked a child, what are you seeing in TV right now? And he says Chota Bheem. Then I boast myself saying, oh, I know Chutki, I know Dolakpur, and I know Laddus and stuff like that. And he starts one full episode of a story, and I don't have the time to listen to it. Okay, and then he'll say, uncle, what did I tell you? Tell me what happened now. And then I am in soup. I told you active listening. Listening means giving a voluntary effort. Okay, this guy is talking from Virudhunagar on a webinar series, and probably 100 people are sitting and listening to it. Some of you might be hearing. Hearing is accidental falling. If some of you are sleeping there, I'd say back. Okay. Okay. I'm sorry that I had to shout into your earphones, but if you had turned and looked at the slide, that means it was hearing. Hearing was reflexive. Hearing was involuntary. Okay. But listening is intentional. You just think, okay, I'm sitting on a lockdown period. There are so many webinars, but I'm in Kerala IDA. But I came in here without interest. But let me give it a shot. Let me try and listen. Maybe this guy would give me something. And that focus, that intentional voluntary effort you do is listening. And communication predominantly is active listening. You have to actively listen to your patient. So 23 seconds of opening statement is something which we have to learn with. Okay, the last 15 minutes, I think I'm going on time. Is it okay?
Yeah.
15 minutes or 10 minutes, I should say. It's going to be on transactional analysis. Okay, this is something interesting. Maybe people who knew about soft skills, this might be something as a take home for you. There are 3 ego states. Okay, there are 3 ego states in all of us. One is a child ego state. When we go to a banquet, okay, in a conference, okay, when you sing in your bathroom, when you dance at home when nobody else is there around, okay, when you put your TikTok videos, okay, you are expressing, right? When you cry, when you smile, when you're expressing, it is your child ego state, okay? Sometimes your friend is in some trouble, right? Your friend is in some trouble, and then you give them a piece of advice, okay? And you become like a motherly figure, okay? And you would say, these are things we should do, and these are things you shouldn't do, okay? So these things come from your parent ego state. If one of your friends is feeling extremely low, you would just give an advice like a grandmother, and that comes from your parent ego state. The adult ego state is the rational problem solving mind, okay? If there is a problem, We don't sit and cry. We sit and cry sometimes. That's your child ego state. You think, how should I deal with it? So how am I going to deal with this whole issue? So you sit and focus on the problem and find a solution. That's your adult ego state. Okay, here I think I have to ask some of you. I think you can type on your chat box. I'm going to ask you, I'm going to put you into a situation where you are in your dental college. I'm going to take you back in time. Imagine that you were in your final BDS. Okay, all of you out there, whichever batch you were there. Okay, so I would like to see the chat box getting with some answers now. So imagine that you were in your final year BDS and whatever subject you didn't like of. Okay, think about that particular subject. You suddenly realized at 9 o'clock or 10 o'clock in the night that there is a test tomorrow and it's very, very important for you to pass this final year BDS. Okay, and what happened is you start feeling like crying. You feel like crying. You feel very upset. And if you cry, that is your child ego state. Okay. So, but then your mother crosses that side and she's shocked. She's never seen this happen before. In last 4 years, she's never seen you sit with a book. And she sees a son or a daughter who's very upset with a book open with tears in the eyes. What would your mother do? Okay. That answer which you're going to type now is your parent ego state. Can I see some answers, please? Can I have some chats instead of some thumbs ups? It would be like an activity. Can I see some people typing something? Can I see this? Is it possible?
Yeah.
On the Q&A section. Okay, somebody said she sits with me and waits for me. Fantastic. Your mother would come and sit with you and say, what happened? Why are you sitting like this? She might say, okay, I would sit with you for some time. Yes, that's a good answer. Anything else? There are about 140 people seeing this. Only one person has answered. Anybody could go back to their BDS days and type something for me? Yeah, type in Q&A. Increase the morale. Okay, don't type it in the Q&A. I think you should type it in, yeah. If you can type it in that thing.
Yeah.
Any other answer?
Sure.
Yes,
we have some answers from some people. My mom
Okay.
will sit and give me company till I finish.
Okay, sir.
Other one says, console me and remind me of my previous marks and reinforces my
Okay.
confidence.
Okay, okay, so I can see that, sir. She would comfort and motivate me. Okay, okay. I'll tell you what else she will do. She might give you a cup of coffee. Okay, she might say you can go and sleep now. I would come and wake you up in the morning, and that would be easier for you to read. Okay, she might comfort you. She might console you. She might give you a reassurance that you did well. Fantastic. Okay, so now I'm going to ask the next question. Apart from saying this, what else would your mother do? There are other things which your mother would do. If you had a daughter who's sitting there, okay, Amma always says, don't get tensed. You just read and write the exam. Yes, perfect. Apart from all this, what else could your mother say? Okay, I have the answer. Same person, Dima Abdul Kader. Full marks to you. Okay, you are the first to answer the first question and this answer as well. She says, why did you not study beforehand itself? Why wait till the last minute? Okay. And Kavita Kumar says, should have prepared from the beginning. Fantastic, right? All mothers would come forward and tell, why are you not doing this? Why didn't you do it from the beginning, right? You should have answered, you should have started your preparation before. Look at this. A parent is somebody who always gives you right things in life and wrong things in life. Okay. As a parent, you also, when you want to advise your friend, you would become like a grandmother and take care of them. If you want to advise somebody, then you might want to be a little critical about them. They will say, okay, manage by your own. They could say anything like that. That is your parent ego state. Thank you for that wonderful answers. So let us look at this ego state. So we understand when we cry and laugh, it's a child ego state. When we give free advices and when we take care of people, it's a parent ego state. When you are solving the problem by yourself, it's the adult ego state. Okay. So mind you, all the 150 people out here, we have 3 ego states. So every time you're going to go back home and talk to your spouses, imagine there are going to be 6 ego states in front of you. 3 in your head and 3 in the other person's head. Who is going to talk to who develops the conversation? Okay. Okay. So what is a complementary transaction? A complementary transaction or a reciprocal transaction is between a parent to parent or a child to child. Okay. When you are drunk, when you are in a banquet, you express yourself, you dance like a child to child. When two parents talk about what is happening in the lockdown situation, how are you managing your children, you talk like parents to each other. Okay. If I ask Faizal sir, how are you doing? And Faizal sir says, I am good, Sharath. How are you doing? Then it would be like this. How are you? I'm good. It's like an adult to adult, a stimulus and a response. It's a complete transaction, which is called a complementary transaction or a reciprocal transaction. This is very good. Look at this situation, which I told you already, a 40-year-old man who walks into your dental office. We thought, why is this guy so fussy, right? Why is he acting like as if he's so scared? Why can't he just sit there and allow me to do the treatment? The dentist says, take your seat on the dental chair. The patient says, I don't want to, I'm very scared. A 40-year-old woman would say this. The dentist says, there is nothing to worry. And the patient says, can I hold your assistant's hand? Can you do it a little slowly? I'm very afraid of pain. I'm afraid of dentists. Okay. This person is expressing his fear. Okay. I told you they have the right to fear. They have the right to browse something. They learned from the internet that you're going to give them an LA. They are scared of needles. They're behaving like a child in front of you. They want you to take care of them like a parent. The transaction would be complete only when you behave like a parent. Okay, look at this. I told you that there is a nurturing parent, a grandmother in you who's going to take care of the children or take care of your friends is the nurturing parent. The other person who says, why didn't you start early? When should you have started? Why did you leave it to the last end, till the end? It's a controlling parent. Okay, so we have the adult and all these children. So what is a cross transaction? When I go and ask somebody, if I ask Kavita, how are you, Kavita? And Kavita, sir, why do you care, sir? Okay, and gives me an expression like that. Then it would be a cross transaction. A cross transaction would be not a reciprocal good transaction. So this sometimes happens at home most of the time. Okay, you sit down for lunch and ask your wife, okay, ask your husband, can you just give me salt? Can you just get me water from the refrigerator? And your wife would go immediately saying, you should have realized that you need water. Okay, get up and take it. Okay, so if she says that, okay, that means you just asked her, can you pass the salt? Okay, if people understand English well, can you pass the salt? The answer should have been yes or no. Then it would have been a complementary transaction or a reciprocal transaction. But what's the answer? You should have realized that you wanted the salt before you sat down. You should have got it ready before you actually got in to do this. Okay, that's the conversation which happens at home. So this is something which I want you to practice at home. Every time you talk to your spouse, think in what ego state is the other person responding. You can be careful about that. Look at this. A patient comes to you and you explain to him what an RCT is. You want to show that you have done 5 years of BDS and 3 years of MDS, and you know what the parts of the tooth are, what root canal system is about, what root canal treatment is about, and you give a good lecture. You have that Colgate models, you have the parts of the tooth, you explain everything. The patient asks you only one thing. He didn't listen to any explanation you gave. He just gently asks you, okay, can you just pull that tooth outside, doctor? Right? You are giving a rational problem-solving answer, but the parent, like the patient is talking to you like a parent already made the decision talking to the child. So this is again a cross transaction. You have to be very careful about this. So look at this. If a patient walks into your dental clinic and says, I need a filling. I browsed on the net. I know that this needs a filling and you better do a GIC filling for me. Okay. So you get very angry when you know when you hear GIC filling, or when you think light cure composite resin. I heard it from one of my friends. The doctors have one blue light and that could be white colored filling. I don't want the silver fillings. Okay, so they did their groundwork. They come and tell you, I need a white filling. I think it's called a light cure filling. You don't want to hear this because you did your BDS and you say, I am the dentist here. Okay, so you look at the patient and you say, the tooth needs a root canal treatment and not a filling. You become angry. You become so egoistic. You fail to understand the patient is talking to you from a parent ego state. And you reply back in a parent to a child ego state. The patient also talks to you from a parent to child. You also talk like a parent to a child. This is because both the parties are making the judgments and the decisions for the other. The patient comes and tells you, do this for me. and you tell them, I can't do this for you. This is a cross transaction. So what should you do? Okay, I need a filling on my lower tooth. That's what the patient says. And you should say, I wish I could do a filling on your tooth, but I'm afraid it's much, much deeper than that. And stop there. Stop there. Please don't show your expertise over the subject. Don't show off all the materials you have. Don't give them multiple options. Okay, don't tell them I have this option, that option, this option for crown, which is this much. The lab charges so much. Don't give them anything. Just tell them, I wish I could do a filling, but it's much deeper. Ask the patient to move from the parent ego state and come down to an adult ego state and ask, okay, it's deeper. Okay, and what should I do, doctor? If it's deeper, what should I do? Hook the person's ego state, pull him from the parent ego state, pull him down to the adult ego state. Let the patient ask you, what can I do for this doctor? Okay, and then probably you could answer, okay, tell him that there is some procedure called root canal treatment, and stop there again. Let him ask you what root canal is about. Then when you finish, you tell him that any root canal needs a crown. So go step by step. I know you are looking at time is money and you might want to finish off patients quickly, but sometimes you feel so angry about the patient only because you fail to pick up which ego state he is in. Okay, so this is an article from the medical journal. Okay, so this is about a medical heart patient, about a heart patient who comes with a cardiac problem, with severe heart pain and angina or something. He comes like a child. This is between a patient and who has a cardiac problem and a doctor or a nurse. Okay, even a nurse has to sometimes act like a parent and take care of the child, or behave like this adult and take care of that particular child. But I am sure most of the dentists, okay, whether you are a periodontist or a general dentist, we always have this child ego state. Okay, I'll tell you why. If you have a 5-year-old child coming into your dental office, you try to ask this child, who bought this bindi for you? This dress is very pretty. What's your favorite color? Which school are you studying? Right? But if a 40-year-old man comes inside your dental practice, I don't think any of you ask, who's your best friend? Who bought this shirt for you? Who's your best friend? How many idlis did you have this morning? I'm sure none of you ask that, because you know when to move into that child ego state. You know, when you talk to a child, you change your voice, you modulate your voice, you do non-verbal communication without being aware of this. So you talk like a 5-year-old when you look at a 5-year-old. So we as dentists, we know that we have 3 ego states. And from now on, I wish that you would focus on which ego state the patient is. And based on that, you would move ahead with those things. So I'm coming to the last 2 slides. The take-home message is, accept that patients can have fears. I told you there are 5 good reasons, scientific proof. I didn't talk about any literature here because it's only for general practitioners. And so there are 5 major reasons for dental fears, and every patient has the right to have his fear. Okay, and so he has the right to browse. He has the right to have multiple opinions, because we browse, we take multiple opinions. The patient also has the right to do that. Never hear. Hearing is reflexive. Listening is voluntary. So I want you to be intentional. Active listening is a major part of communication. And I told you, in communication, pick up those non-verbal cues. The non-verbal communication is the predominant one. Empathize and never sympathize. Don't try to share the person's thing and divide this thing. It's always empathizing, putting yourself in another person's shoes. When I say another person's shoes, it includes your patient, it includes your receptionist, it includes your assistants, everybody. Don't forget gratitude when the COVID is done. Remember the 3 ego states. Talk to a 5-year-old like a 5-year-old. Okay. So when you go and look at customer service jobs, these are the 10 things. I collected these kind of 10 things in different colored pictures, and we have spoken about communication, listening, a positive attitude, being very firm and decisive, being a good leader, taking responsibility, empathy. Don't fake yourself. Don't fake ingratitude, depersonalization, conflict resolution. Whenever there's a conflict in the department or whenever there's a conflict in your clinic, I think as a good leader, you have to sit with the team and do that. And that's about interpersonal skills. I told you, if we could develop all these skills of doing well, okay, and he certainly knows how to make his customer feel, because we have, I know in Kerala, every 10 meters, you have a dental clinic sometimes. Okay. So everybody wants to make a win-win situation. So we must know how to make a customer feel happy. And so obviously from Tamil Nadu, I can't miss out Rajinikanth, and I've shot Mammootty and Mohanlal. So I just thought we'll finish with Rajinikanth here. And I said I'm a pediatric dentist. So I would most of the time talk to my patients like this with my mask hanging around my chin. But I think when we go back to practice, it might be like this. Maybe that child would have become old enough like this. We never know when we start practice. Or maybe our protection needs gears have to become like this. But mind you, this is also going to be there. This is like that Lady Gaga's dress costumes, right? Trust me, the dentists are also scared. So we might have to protect all of them around this. I want to finish with one small story, just a 1-minute story because I like stories. This devil, okay, the devil decided to retire, okay. So he thought he will sell all his tools, okay. So he neatly arranged all the tools in a very decorative manner, and he named the tools, each tool like hatred, jealousy, anger, envy, all those kinds of things. He just put all the tools and he put a label to it, and he was saying, I'm going to give a discount sale on because I'm going out of job. I'm leaving my business. I don't want to be a devil anymore. Okay. But there was one tool which was very, very old, very much used. Okay. And one of the customers who was surprised asked the devil, why did you put it on top, very far away from the other tools? Why is it so much being used? The devil just said, that's a very expensive tool. That's the tool which I use most of the time. It's very expensive because that is one thing which I can use when all other tools fail. Okay. And that tool is very, very expensive, and I'm not going to sell it right now. And this guy became very curious because this guy knows transactional analysis. So the devil didn't give too much of information. The customer became more and more curious. So he wanted to ask, what is that tool? And the devil said, that tool is called discouragement and depression. Okay. So I'm sure most of us in this lockdown period, we feel a little anxious about our practice. I know we do a lot of things at home, but discouragement and depression is something which we must throw away. We must find something positive in anything you do. And I think the most important soft skill that this particular lockdown should teach us, because the devil will win only when there is a sense of discouragement and depression. And I'm sure we are not going to give that to the devil. And thank you so much for giving me an opportunity, Kerala State IDA. I don't know, I know I shooted time by 1 hour 15 minutes, but I think I would have shared some of my experience on soft skills. Thank you, sir. Over to Faizal, sir.
Thank you, Dr. Sharath, for your excellent lecture. And it is always a pleasure listening to you. Always enjoyed your lectures.
Yeah. Thank you, sir.
I'll check whether
Sharath, it is a wonderful presentation.
Thank you, sir.
Thank you, Sharath. So many take-home tips are there. Thank you, Sharath.
Yes, sir. Thank you. Thank you so much.
Yeah,
Thank you for the opportunity.
I'll check whether there are any questions.
Yes, sir. There's a question which I can see. Yes, sir. You can go ahead.
Yeah. Wait a minute. That question you already answered, I think. That is it possible to change the parent-child conversation to adult conversation?
Yeah, yeah. You should always don't give so much of answers. You should never give so much of information. Don't show your anger on the patient, even if you are irritated, right? I don't say you have to feel like Buddha. Close your eyes and feel very happy about it. Don't show your anger or displeasure on the face, right? So just make sure that you don't comply with whatever his whims and fancies are, right? You need to make sure that you give limited information and don't give him overboard information, because he's not going to listen. A person who has already made up his mind and going to talk to you like a child, and he's going to take the parent role, the only way is give him minimal information and make him come down to the adult ego state. So talking there wouldn't really work. Non-verbal communication, a smile on the face, a gentle gesture, a wink on the eye would probably bring him back to the adult ego state.
There is one interesting question. Great person. How to deal with the patients who bargain?
Okay, sir. Okay, sir. I told you because as a periodontist, I know I have some friends in North Kerala and then I have some friends in South Kerala. They tell North Kerala charges differently and South Kerala charges differently. I tell all of them, that's how it is. I can't charge what is charged in Mumbai and Bangalore. Don't worry about it. Don't see, I always tell them, this is not a vegetable market. Okay. And I tell them sometimes in a very smiling way, just see, don't give them so much of explanation. Don't be very angry on them. Okay. Okay. I'll ask you this question. When you go to Flipkart and when you look at your Amazon, whichever gives you the better deal, we always take that, right? The patient wants to know if I can get a deal. It's up to you to give the deal or not the deal, right? So I have seen one of in E-Road when I went to for practice, I saw one general practitioner. He reduced orthodontic charges from 20,000 to 15,000 rupees. Okay, 5,000 rupees just reduced. This is 8 years back. He reduced 5,000 rupees in that 20 minutes. I did that pulpectomy. I saw him talking to a patient. He said 20,000 rupees because it was a known patient. But he reduced to 15,000 rupees and said, I will only charge the orthodontist charges and I will give it free. I told him, don't do that because if the patient knows that 5,000 is your profit, okay, that means you're the loser. I told him that this patient is not going to come to you because you just reduced 5,000 rupees. So don't reduce it. Just tell them that you can first say that this is how the charges are going to be because these are the things and stop there. You can try telling them sometimes in a very smiling manner that you don't go and go to when they come for in an injection or they go for a lab test in a medical hospital. I'm sure they don't ask for a discount, right? So you can tell them those kind of situations for them to understand, right? Everybody wants to pick up something. Even when you go to a vegetable market, I'm sure 10 rupees tomato, you want to buy it for 8 rupees. So it's still all right for them to ask, but it's not necessary for you to reduce the price. If you reduce the price, that you are the loser, right?
There's one more question. How do you plan or approach a pediatric patient with all the PPEs?
Okay, how do I plan?
Yeah.
Okay, the only thing I learned from whatever I could get from Dr. Gopi Krishna's stuff and lot of things which are happening. Only thing I could understand is not to go into practice till June. So that's going to be very difficult for us. I'm hoping that things would make it a little easier. But I personally would answer that. I know it's from Kavita, so she probably wants me to answer something different. So that's for you, Kavita. I think we should wear different kinds of scrubs because I listened to Gopi Krishna's suggestion. He was telling that a lot of things which are put up in across the world and this thing might not be feasible for us. Okay. So if you have a practice where you can shift to a scrub, see, I have a Superman scrub. I have cartoon scrubs which I wear in my I used to wear these kinds of scrub in Chennai and I don't use it anymore. I think I will wear those scrubs. He said all practitioners must have a bucket and soap or buy a washing machine in a private practice, right? So I would look as attractive as possible for them, for the child. I will definitely wear a COVID-95 mask with some colored pictures on it, if possible, a sticker on it, right? And then I will have an OHP sheet, okay, which is only 3 rupees, not the shield because the shield is going to be very expensive. An OHP sheet with a girl's band, right? Like the band which I'm wearing right now. We have these girls' bands. I'm sure you can pick one from your daughters and put it on the OHP sheet and wear it like a shield on top of it, okay? So you must have your N95 colored. You can have a different kind of pink bands for the girls with this thing. So I know it's going to be difficult for pediatric dentists to be going like a Halloween kind of thing. And we have to make it as interesting and presentable for the child as possible.
Any other question?
Yeah, transactional analysis. You can read a book called I Am Okay, You're Okay. There's a book called I Am Okay, You're Okay. But most of these books on transactional analysis and most of psychology, whatever I talk, okay. So these things are all related to medicine or they're related to psychological depressions and kind of thing. So I steal those concepts and I convert it into dentistry. So I don't think there is any book on transactional analysis in dentistry as such, but there is a recent article on this. Okay. I will get, I don't remember the article because it's just published because we were trying to talk about this in forums recently. And I found that I will pass that to Faizal sir I can pass on these books. I am okay, you are okay. I have e-copies of those kinds of books as
well. There's one
Okay.
question here. Can you read it, Sharath, or should I?
Yes, sir. Yeah. Sir, some of them are not ready to give medical history properly. Then how can we get information regarding this COVID-19 from patient if some family members are quarantine affected? I tell you, Kerala, you're doing a wonderful job. Okay. I think the first state which is going to get out of COVID is going to be you guys. Okay. And predominantly, I think the answer which I've taken from why I would like to quote Gopi Krishna's thing is, I've heard a lot of people speak about COVID, but this guy again, he was my senior again. Faizal sir should know him, was much junior to Faizal sir there. But he's telling practical ways to get it done. So he's telling the best way, even if the lockdown is open on May 3rd, the best thing he's telling is don't practice till June. Okay. And you have to start in June. There's no choice for us, right? Once you start in June, I'm thinking that most of the things will settle down by early this thing, right? So asking them about fever, even if they tell you I had fever, okay, what would you do? The patient says I had fever and throat ache, right? Even I have had throat ache and fever, or all of us would have experienced some amount of throat inflammation or anything in the last 1 month, right? So we cannot be probably COVID thing. We have to tell them that it's going to be dangerous for you. I think the threat you place on the patient will be most important. I know it's sometimes not a good thing to tell, but I think understanding the psychology of people, you can tell them, I am protected well, but you could be a danger if you don't tell me the truth. And that's the only way to get the truth out of patients. Right? If you have a PPE and a COVID mask and a shield, I think we will definitely be protected if you don't have much of aerosols. But if the patient had COVID, he's going to be more dangerous, right? So you will have to tell him. But some of them, I just spoke to my brother who is the director in Michigan State, USA yesterday. He was telling USA, we were very, very scared 1 month before. We didn't know how to do it. By May 1st, we will be definitely back to work in a normal way because we have learned it much faster than the other countries. Okay. I don't know. He's so confident because when I spoke to him 2 weeks back, he said, it's very, very dangerous. Don't get out. Okay. But yesterday he said that they found out the way, and people will understand that it's very important to tell the history. But again, he said the same thing. In USA, they will tell the history properly. In India, we are not sure. The only way is to put them in trouble saying that you are going to be more dangerous than us. And maybe that's the only way we can get the answer.
Can I add a few points,
Sure.
Yes, sir. Yes, sir. Yes, sir.
With your
Go ahead,
permission?
sir. Feel free, sir.
Yeah.
Because, yes, sir. Feel free.
Yeah. My request to all the people who are going back to practice is that the IDA has provided a risk assessment form. Ensure that all your patients fill in the form so that at least we have some document that says that the patient has not withheld any information from us. When you're treating the patients, and ensure that you educate them, like sir was saying before, educate them regarding the need for treatment, and only if there's an absolute need for a procedure, start the procedure. Because as of now, the government is also saying that don't do any procedures unnecessarily. Even today, there was a question posed to the Health Minister of Kerala, and she's answered saying that don't do any unnecessary procedures, and she's given instructions to patients only to come for emergencies to clinics. So the basic thing that we should follow is ensure your safety, thus ensuring the safety of the community. Thank you.
That's a very, very important point. So we have to make sure we are safe first. We have to follow the guidelines because we would be the one who would be in trouble.
Yes, our safety first. Then our duty comes. Okay, thank you, Dr. Sharath, for your excellent lecture.
Yes,
really enjoyed it. And I thank all the participants of this lecture. More than 150 were there attending this lecture. I thank each and every one of you. Next week, we are going to have a practice management session with Dr. Latif. The time and the other things I'll put it in the group by tomorrow. Thank you. Thank you one and all for attending this lecture.